Good morning, Elaine. It's a pleasure to have you with the World Federation Neurology YouTube channel today. Dr. Elaine Jones is Board of Directors from American Academy of Neurology. She's also a very active member of World Federation Neurology Public Awareness and Advocacy Committee also. How are you? How are you coping in the middle of the pandemic?
I'm very well. Thank you, Tissa. I'm excited to be here to talk to you about World Brain Day today.
Absolutely. How excited are you the upcoming World Brain Day 2020?
I'm very excited. I think this is fantastic. It's a nice opportunity to focus on a neurologic problem. Each year, the World Brain Day focuses on something specific. And this year, Parkinson's disease affects so many people worldwide. And there's so much we can do for these folks. It's good to focus on it and bring us all together to discuss it and end Parkinson's.
Dr. Jones, tell us about your training and your early career time.
Sure. So I trained and then practiced in Rhode Island in the northeast of the United States. I started in my own solo private practice after a short time in a community hospital there. And so about 14 years, I ran my own solo private practice, and I really enjoyed doing outpatient general neurology and neurophysiology, which was my background. At that time, I also got involved with the American Academy of Neurology. I started working with them in their Advocacy committee, which was the government relations committee, and ended up chairing that committee, where we worked with Congress in the US on issues related to healthcare and neurology specific. And then shortly after that, a few years ago, I actually moved down to South Carolina to assist my parents who were aging, and now I do teleneurology exclusively. So working across the US, seeing patients in the ER for acute neurology issues.
And how is it going? How do you enjoy teleneurology?
So teleneurology is great. I've been doing it since before the pandemic. A lot of people are now doing it. And it's different. I miss the solo practice, the general neurology, but it's a great lifestyle. It's great work-life balance. So it's a great work-life balance. You know, you have shifts that are scheduled. When you're working, and when you're off shift, you're off. And I can kind of compress my work schedule down and take time off so I can travel and do other things that I'm interested in.
Do you miss the point of care examination, physical examination bit, or are you comfortable doing it through video links?
Comfortable doing a video exam at this point. There are limitations. You can't do everything. I think the thing I miss with the telework is the continuity of care. You know, we're doing primarily emergency coverage. And so often you don't see the patients long-term. You don't see them again ever. So you don't know the outcomes. I miss the relationships that I developed with patients and families.
So on a typical day when you do emergency neurology through teleneurology, what sort of assortment of cases would you get to see?
Mm-hmm. So it, of course, started as Telestroke so that we could get in quickly and treat patients appropriately with interventions for acute stroke. Mm-hmm. But of course, as we all know, there's not enough neurologists anywhere. And so everything neurologic that comes into the ER, we get called on. So it can be mental status change, it can be vertigo, it can be migraine, it can be MS. So we do still see everything, but it's more the emergency side of it that we're seeing.
So coming back to the another aspect, your the commitment or your involvement with American Academy of Neurology. Tell us about it.
So yeah, as I said, my involvement started with the advocacy arm of the AAN, and we worked a lot with federal and state governments on legislation to help with healthcare and specifically access for neurology patients. I now am on a committee. I chair a committee called COPAY, which is Coding and Payment Policy. It's a subcommittee of Medical Economics and Practice Committee. So I've been on the board of the Academy of Neurology for about 6 years now, and it's really a rewarding opportunity for me. The organization is a great organization. It's really focused on our profession, on our members, and on providing great care to our patients.
I'm also aware that you have been doing a lot of charity work in Haiti. How did you get involved with Haiti? And tell us the story of why you are doing that and what impact this experience is having on you, and obviously in Haiti health system also.
So I started going to Haiti in 2011, 1 year after the earthquake, and I learned about it through a neurology colleague who was going there, who I met through an AAN committee. And I've been going there yearly, sometimes multiple times during the year, and work at a variety of clinics. But we've been basically going and teaching the doctors there how to do neurology. They had one neurologist in the country who actually a few years ago left. And so there was very little access to neurology care. So we work with both pediatric and adult patients at a hospital in Port-au-Prince. And we're also now focusing on teaching EMG and neuromuscular care and on doing EEG. I think the other thing that's been rewarding for me is getting involved with the World Federation of Neurology. So a couple years ago, we worked on an advocacy course that was offered at the World Congress. And I think that's been a great opportunity as well to get to know my colleagues around the world. I think there's so much we can collaborate on. So that's been an exciting opportunity as well.
I agree. I think these international organizations, if you go to an American Academy of Neurology meeting or World Federation Neurology meeting, you could basically see United Nations, different kind of people, different kind of costumes, still working on a common goal. They all wanted to bring the best brain health to the folks that they are looking after. And my motto is that when we deal with brain problems, whether it is Parkinson's disease or stroke or multiple sclerosis or peripheral neuropathy, the suffering and impact is human and it is universal. It is not American suffering or British suffering or Australian suffering or Haiti suffering. It is just a plain human suffering. So the solution has to be universal also. And that's what we are working together, the AAN, WFN, IPMDS, so on and so forth. One last question. When you were entering into neurology training, did you have difficulty getting into training or going through training because you are a woman, or there was no such issue at that particular time of your training?
So it's a great question these days. I have been fortunate in that I have really not had a lot of problems. I think depending on the area you work in and the program you go to, it varies widely. I was in a more clinically focused program. There really were not big issues for women and men in the training program. We had a nice mix for our faculty. So we had a great representation to learn from. I do think in more academic centers, high-powered academics, research and science areas, that there are more struggles based on gender and other biases. So I think it's something, we're learning and we're focusing on, but we have a lot of work to do on it, unfortunately.
You see, my point is, again, it comes back to brain. All this human behavior, they are not being driven from your foot. They are being driven from brain. So it all comes back to brain matters the most. So we have to advocate on those issues also, so that we can see a just world where everyone has a fair go.
Right.
My last question, Dr. Jones, apologies for the technical difficulties. What is your final message to younger folks that are out there, whether they are watching this from Haiti or Sri Lanka or the Africa or North America or South America?
We are a great community. Neurologists around the world are a great community. There's great resources. And I agree. I think your point of if you're a patient with Parkinson's disease in Haiti or Parkinson's disease in the UK or in the US or in Australia, your issue is the same. You have symptoms of Parkinson's. And so the best that we can do for these patients in supporting them and treating them, we need to share our knowledge. I think it's a great field to be in. We've made great strides in diagnosis and treatment. The brain is where it's all at. I think the brain is amazing. It's always interesting.
So talking about American Academy of Neurology, you have over 25,000 members worldwide. not only USA, it's truly a global organization. How do you want American Academy of Neurology members to respond to World Brain Day? How can they take part? How can they use the material that we produce in collaboration with Movement Disorder Society?
I think there are a lot of resources that we can access, both in the American Academy of Neurology website, the World Federation of Neurology, and the Movement Society all have wonderful resources. We need to tweet these out. We need to share them with each other. We need to share them with patients. We need to get the word out, get the buzz going so that people can start focusing on this and really help our patients.
Do you see this pandemic as a threat to us or an opportunity to execute our plan and put brain health as the most supreme wealth?
I think it's been an exciting opportunity. As difficult and devastating as it's been, it's forced us to change the way we do things. And I think we are in some ways more connected than ever. Using the internet, we can get the word out. People are more comfortable using the internet for patient visits, for conferences. And so I think it's a fabulous opportunity. It's really created some great opportunities. Unfortunately, it's a tough way to go through it.
So you are inviting AN members worldwide to partner with the World Federation of Neurology. We are family anyway, and use this material from all three organizations and websites and collaboratively use as much virtual environments as possible while respecting physical distancing, social distancing rules, but still get the bus out and keep shouting out and be the best advocate that you can be for your patients as well as colleagues. Let's have a wonderful World Brain Day. Thank you very much for your time. We'll talk to you again soon.